we ended up on
So first
number.
things first, we need to make sure that you know the
Okay, so let's continue. So we are on the tenderness as of earliest sign of your what? Earliest sign of your phlebitis. So since ang phlebitis is all about init, okay, may redness, okay, warm, okay, take note of this management cold compress. And when you do your cold compress, make sure na sa 30 minutes lang siya dapat ha, para hindi magkaroon ng rebound effect. Rebound effect will happen if more than, rebound effect will happen more than 30 minutes application. So pag more than 30 minutes application, magkakaroon siya ng rebound effect. What is rebound effect? If your cold compress is for vasoconstriction, no, gina-vasoconstrict niya, ang mangyayari niyan, if you apply for more than 45 minutes, the rebound effect would be vasodilation. Yun ang effect niya. So be careful on that. At least alam niyo na ngayon na 30 minutes lang ang application niya. More than that, rebound effect na siya. The warm compress, the action of your warm compress is, this is for infiltration, pag may dislodgement. Kaya nga para malaman mo kung okay ang flow ng IV mo, patent siya, ibaba mo ang bottle niya. So pag may warm compress ka, make sure 30 minutes din siya because it will give your vasodilation. But more than that, if there's a rebound effect, syempre vasoconstriction yan siya. So the local anesthetic here is considered as your cold compress. Siya ang tinatawag nating local anesthetic cold compress. Kaya pag may mabukol class, anong pinabili nyo? Ice. Pag may mga, okay, this would be applied 24 to 48 hours after the injury as a first aid measure. 72 hours after, ano nang ibigay natin? Warm compress na dapat. Okay? Para to promote what? Circulation to the blood that is accumulated to the area. Okay? Promote circulation and nutrients to the tissues and cells. Number what na tayo? Number? Okay, number 62. 61. So which nursing intervention is appropriate for the nurse? ICU taking setting up supplies for Irene, age 45 or required. Okay, blood transfusion. Usually, but blood transfusion class, remember, it will take 2 nurses to do the transfusion of the blood. Para sure na sure ka dapat kung ano ang name ni patient. Dapat alam mo yung name ni patient. Alam mo yung blood type ni patient. Alam mo yung kailan na-expire yung blood. At the same time, alam mo kung anong blood transfusion ang ibibigay doon kay patient. So, hindi lahat ng patient is, for example, ang patient nagkaroon ng hemorrhage during delivery. Pag hemorrhage during delivery, hindi lang yung blood component ang nawala or ang plasma. So, lahat sila ay nawala talaga. There's a heavy bleeding, so hindi ka lang magbibigay ng PAC-RBC dito. So, ang ibibigay mo kay patient is what? Whole blood ang ibibigay pag hemorrhage. Pero pag may mga kidney problem ang patient, no? Pag kidney problem ang pinag-uusapan, then do not give whole blood kasi ang problema lang sa kidney class, chronic kidney injury, is you have your RBC. Why? In your kidney, there is what you call epoetin. It is a hormone that will stimulate your what? Your bone marrow, especially the red bone marrow, to produce RBC. So kung sira ng imong kidney, wala naman produce ang epoetin Kaya ang patient na may CKI, they are having what you call anemia and shortness of breath. Kaya usually ang doctor pag severe na ang anemia, gagamitan nila ng PAC-RBC. Now, on your blood transfusion, always make sure that it is a gauge 18. Why? Gauge 18. Kasi pag mababa ang number, the lower the number, the bigger the bore. There's a spell that we need to remember on your blood transfusion, especially on the needle. The lower the number, the bigger the hole. So we need to have a bigger hole kasi ang blood mo is medyo ano yan siya, hindi siya fluid masyado. So may mga ano yan siya, may viscosity part. So kailangan makapasok talaga ang dugo sa vein ni patient. So make sure that the bore of the needle is what? bigger. Gauge 18 usually, pag walang gauge 18 sa exam, then use the 20. And it is only compatible to what solution dapat? Plain NSS. Compatible ang inyong dugo. And when you are giving na the blood to the patient, make sure you have to observe the patient, check the vital signs every 15 minutes. So pag 15 minutes, ano ang patient? Nasa critical condition, okay? Critical condition. So because we need to observe if there is what you call reaction during the blood transfusion. So once there is a reaction, whatever reaction it is, remember, discontinue the transfusion. Okay, discontinue, stop the transfusion as much as possible. If you see the patient is having wheezing, difficulty breathing, so it might be the patient is having what you call allergic reaction to this. So need to stop and notify the physician. Not just notify the physician, but you need to do first your action as a nurse, that's to stop the transfusion. Okay, maximum hours is 6, but the best hour is 4. Kaya ang nidiscuss sa atin is 4 hours lang. Nga naman, prevent hemolysis. Hemolysis meaning, lysis is breakdown, hemo is blood. So when there's a blood breakdown, remember, your blood is a component of cell. So may sa cell na dyan ay nakatira si potassium. Kung masisira ang cell kasi may hemolysis, lalabas si potassium papunta kay blood vessel. So ang titira na ngayon sa blood vessel ay si potassium. At iniiwasan natin yan mangyari because delikado pag mataas si potassium or may tawag ng hyperkalemia. Dahil sa hyperkalemia, magkakaroon tayo ng patient ng arrhythmias. No? Magkakaroon ng arrhythmia si patient. So, once the patient is having this kind of condition, dapat ikaw nga nurse, alam mo kung anong kailangan i-prepare because later on, the doctor will order for what? ECG. So, attach the patient to the ECG monitor. Now, what number? Okay, here's the next number, 61. Prime tubing. Prime tubing of blood administration set with normal saline solution completely filter. Okay? All right. Now, let's go. Number 62, rare blood type is scheduled to elective surgery and may need blood transfusion. Which question by the nurse would be most appropriate based on the patient's upcoming surgery? What has your surgeon told you about donating blood for surgery? Kasi ang sabi niya, a patient with a rare blood type is scheduled to, okay, rare ang blood type niya. So anong sabi ng doctor about donating blood for surgery? Kasi nga, rare. Have you ever donated blood for family member? Do you have any family members who have your blood type? Okay, so you must know first that the conversation between the patient and the doctor. The question here is, I was confused because when it is a policy that when the doctor is doing the rounds, make sure nurses are always at the side of the doctor. So, haven't you there? Have you not there during the time that the surgeon was giving a talk with the patient? Parang ganun lang. But this is the best compared to the other option. Alright. While checking a unit blood, nurse notes that one number is different on the blood bank from attached to the unit blood and the actual blood bag. What is the appropriate return? You need to return. Just return the blood. If you're not sure. If you're not so sure with that thing, then return. Next is, ito na yung sinasabi ko, when the patient is having what you called, there you go, quite a long time, nagkakaroon ng hemolysis, so dapat tandaan na magkaroon ng monitor the potassium level of the patient. Sabi ko na yan. While receiving the blood transfusion, ito na, may mga chills, tachycardia. What are you going to prioritize? Stop that transfusion. That's it. Simple as that. Number 66. She is experiencing burning on urination frequency and urgency. Oh, most probably the patient is having UTI. No? So, this is common problem. Cloudy pa talaga ang ihi niya. So, there is a urinary infection. Anong kibahan ni UTI na upper and lower? When you are having upper UTI, take note, nagkakaroon ka ng fever. Pag lower UTI, take note, no fever. Yan ang kaibahan. So both UTIs has dysuria, which means that is pain upon painful urination. It might be hematuria, or there is what you call a pass in the urine. So, what is the causative agent of your UTI? That is your E. coli. Normally, saan makikita ang E. coli? Sa large intestine. Kaya when we wipe our anal area, make sure that it is from from anterior to posterior, or from front to back. No? Yan ang pag-wipe dapat, or up, down. That's the proper wiping. Next is your when I say cystitis, that is a lower infection which is part of your bladder. Cyst means bladder. No? When you say the word cyst, that is a bladder. Pyelonephritis, this is a problem on your kidney. Okay, that is in the kidney itself. Infection in the kidney. Now, a male patient returned from the operating room 6 hours ago with a cast on his right arm. Oh, casting. He has not yet voided. Which action should be most beneficial in assisting the patient to void? Okay, give him the urinal to use in bed. Give him the urinal to use in bed. Why? Imagine that stimulates, no? That stimulates urination. Pag may makita tayong mga ganun na parang arenola, CR, kataihon ka, kalibangon ka, or you increase the running water in the faucet or in the toilet that they can hear, it stimulates what? Urination. Letter C. To minimize the patient experiencing nocturia. Okay, what is nocturia? Nocturia, it is urinating at night. Why? Because of the heavy activities in the day. So most probably, especially before matulog, umiinom pa ng tubig. That would lead to what you call nocturia. So iba naman yung enuresis. Enuresis is a bedwetting. Ang nocturia is parati kang nagigising, na-disturb ang sleeping mo because of ihi ka ng ihi. This common class, if papunta ka na sa condition na tinatawag ng diabetes, no? Paihi ka ng paihi, parati. 69. Catheterization on a female client. If the catheter slips in the vagina, nurse Quintin should. Okay, so that is a question. Okay, let's go first, catheterization. When you say catheterization, guys, this is a procedure in order to assist the flow of the urine. So most probably, if I have urinary retention, ang ginagamit na catheterization dito is what you call your one-way. Pag sinabi kong one-way, it is called your straight catheter. Pag sinabi kong straight catheter, there is no balloon on this one. Walang balloon, ha? Urinary retention happen especially when you are having delivery. Ang nanay, puno ang bladder niya, nahihirapan ang baby na lumabas. So, tendency kailangan mag-perform ang nurse muna ng, straight catheterization. And take note, there's no balloon on it. If the time, the nurse on the delivery, ang topic during delivery, at tinanong how to insert a catheter, a straight cath to a patient with urinary retention during delivery, what's the position? Hindi ka magtubag o dorsal recumbent. You answer lithotomy. Pag delivery. Pero pag hindi siya delivery, an ordinary ward situation, make sure that the patient is on dorsal recumbent. Okay? Dorsal recumbent. And if you're gonna have to clean the meatus of the area, use your what do you call this one? Disinfectant or your antiseptic. Very good. That is your antiseptic. So para mas maintindihan mo, antiseptic, this is for human, while your disinfectant, that is for an object. So still, Okay? So if they're combined together, the product that is being used is what you call your antiseptic plus disinfectant. The product is what you call your alcohol. So when you're gonna have to check your alcohol, you will see there that there is a disinfectant and antiseptic. That's why if you use your alcohol every now and then, there is a dryness on your palm. Okay? What else? All right. Now, here we go. In your other catheterization, guys, for male catheterization, ang position naman is supine. Ang male, ha? Okay. For taping, saan iti-tape? For female, i-tape mo siya sa inner thigh. Okay? Taping, inner thigh. And then male, it's in the lower abdomen. Okay? Lower abdomen. Next is your... Okay. Next would be, so yun na nga ang situation na pumunta sa vagina ang catheter. So just leave it there and then get a new one for the sake na that would serve as your landmark. No, it will serve as your landmark. So the answer for that is letter A. Now, another one is the nurse notes the Foley catheter has been empty for 4 hours. The party action would be has been empty for 4. Okay, let's go. What is a Foley catheter? A Foley catheter is considered as your indwelling catheter or your two-way catheterization. Ito na yun siya, nilalagyan na natin ng balloon at meron siyang urinary bag. And take note, the urinary bag must be hung not on the side rails but on the bed frame, ha? Not on the side rails, pero dapat saan siya? Bed frame. Kasi pag ihulog ang bed frame, side rails, mahulog ko ang bag. Baka mahulog na ang imong urinary bag. Now, so ano ang purpose ng urinary Foley catheterization? The Foley catheterization is just to assist the bladder to empty in times that the patient is unable to do so. So especially during the operation, so there will be a Foley catheterization for that. So your bladder could empty, could make it full. It makes the full bladder class. The time to make the bladder becomes full, it takes 2 hours. No? Pwede mo na siya ikanapod. Pero pag 4 hours na nga wala may na-drain dito sa bag, check for the what? Kink. Okay? Baka na-kink ang tube or the rubber tube. And you know that the rubber tube in your catheterization is self-sealing. Pag i-puncture mo gud ang tube sa needle, hindi na siya magpiswit ang ihi because self-sealing tube na sila. And take note that the catheterization will not be more than 3 days in order not to have what type of infection. Very good. It's not nosocomial but iatrogenic infection. When you say iatrogenic infection, there is an infection received because of treatment. No, may infection ka nang tanggap because of the treatment. While nosocomial, you are just exposed. No, exposed ka lang sa hospital, kaya nagkaroon ka ng infection. Or this is what you call hospital-acquired na infection. Okay? Now let's proceed to the next one. This is all about 71. Oh, this is what you called gastrointestinal bleeding. What happened then? What color stool does the nurse anticipate patient to have? Where? Oh, okay. Now, okay. The bleeding on the GI. Take note of this. Bleeding on GI, it depends on the area. If it is upper, take note of the dark stool or it's called your melena. Why? Nasa taas kasi pag bumaba niyan, itim na yan. Masyadong na-expose na sa loob, na inita na siya. Pag lower bleeding na siya, okay, lower GI, fresh stool. So, a fresh stool, fresh blood, yan siya, which means red ang color. No? So, may mga hemorrhoids ka, that is your hematochezia. It's different one, hematochezia. Okay? So, this is letter A. Very good. When assessing a 55-year-old patient who is in the clinic, a routine physical nurse instructs the patient about the need to obtain a stool specimen. Fecal, okay, let's go with a guayak. Guayak stool exam, okay, guayak stool exam, or this is considered as your fecal occult blood test. When you say occult class, that means hidden. So, kailangan talaga siya madala sa laboratory at matingnan kung may bleeding ang patient on the GI tract. So, with that guayak stool exam, you have to instruct the patient not to eat red meats before the examination that will give you a false positive result. False positive ang mabibigay niyan sa iyo. Bawal din magbigay ng mga vitamin K kasi hindi false negative ang mabibigay niya sa inyo. Why? Kung may bleeding na nadaan ako at hindi pa inom mo siya ng vitamin K, it will stop the bleeding. So, it gives you a false negative. Bawal ang mga aspirin, it will give you a false positive result. Okay? Now, let's continue. So, number 72. Alright. So, this is a test for what? Colon cancer. No? Colon cancer. So, usually colorectal cancer class, it happens during elderly, ha? Pag colorectal cancer ang pinag-usapan, colorectal cancer, it happens during elderly. Especially, ang patient is nasa 50 and above. Dapat may digital rectal exam na sila annually or yearly. Dapat i-perform na yan sa kanila. And at the same time, common dito sa colorectal cancer are your processed food. No? So, processed food. Paano usually ng anong common na mga initial signs or warning signs of that? There could be a rectal polyps. No? Maraming rectal polyps. And what else? And most especially if you are having inflammatory bowel syndrome, IBS. Disease that or disorder. Inflammatory bowel disorder. Anong kaibahan ni IBS sa IBD? Ang IBS mo dahil ito sa stress. Kaya tandaan mo ang IBS mo or your irritation bowel syndrome. This is all about your stress and meron siyang diarrhea but later on meron siyang constipation. So gumaganon ang kanyang episodes. Inflammatory bowel disorder, it is an autoimmune. Ang turo ko sa inyo ba sa autoimmune, ano nga? This is because of antibodies. Pag sinabi ng antibodies, remember, sisirain nila ang intestinal lining mo. So ang patient ngayon ma-irritate na diarrhea lang lahat ito. So it is divided into two, your Crohn's and your ulcerative colitis. Okay? Ulcerative colitis and your Crohn's, that is part of your inflammatory bowel disorder. So, ang Crohn's, tandaan lang, diarrhea lang yan siya. Pero ang ulcerative colitis, diarrhea with blood. Now, let's proceed. Okay. Number 73. Occult blood, the nurse instructs the patient to ask the patient to void. Wash the patient's perineum. No, not as sterile because your breath is clean. So, it's clean lang pa rin siya. Plan to collect the first specimen of the day. Before collecting the stool sample for... Okay, bakit kailangan... Okay, now, I get it. Because para hindi mahaluan siya ng other specimen. So, you need to ask the patient to void first and then do the occult blood examination. 74. So, the nurse understand the cleansing enema is ordered. Okay, this is an adult. Pag cleansing enema, guys, remember, it depends. If it is a child, it is 500 ml, while an adult is 700 to 1,000 ml. Tandaan niya na, 700 to 1,000 ml, that is for your adult, while the child is 500 ml. Now, cleansing enema, high cleansing enema, and the low cleansing enema, for the entire colon, you answer high cleansing enema. Entire colon yan siya ang ginagamitan niya. So, the position to be done to the patient is left side lying, dorsal recumbent, and right side lying. That's the best thing that you have to remember. Pero pag low cleansing enema, ang gina-focus nila is sigmoid and descending colon. Descending colon. So, pag descending colon, ang position mo lang dyan is left Sims position. Left Sims position lang. Alright. Next, when the patient is complaining, initially the patient complains initially when the patient is complaining about cramps lang man initial cramps, okay, you need to stop and return when cramps is gone. When cramps are gone, so stop muna kasi initial lang man na siya, na normal lang na siya na mag-adjust ang imong intestine. But if there is severe cramping na talaga,